Hey everyone, welcome back to the Outcomes Rocket Founder Stories. I am so excited to have you all tune back in. Today, I've got the privilege of having Kyle Kiser on the podcast with us once again. He's the CEO of Arrive Health. They're an industry-leading provider of data-driven insights to points of care. And as a thought leader in health technology and a diligent student of the complex healthcare value chain, he's been at the forefront of some of healthcare's most transformative initiatives. I'm excited for him to just kind of talk to us about what they're doing for their aspirational vision around consumer choice. So with that, I want to welcome him to the podcast. Kyle, thank you so much for joining us again.
Glad to be here, Saul. Thanks.
My pleasure to have you back. So look, you guys sort of did a rebrand. Now you're here with the new company. Talk to us a little bit about that. And then, let's build in a little bit about you for those that haven't gotten a chance to meet you. What is it that drives your work in entrepreneurship and healthcare?
Sure. Yeah. Let me, I think a little bit of our company founding story is probably important context. So one of our co-founders is a guy named Kevin O'Brien in Denver. He's still a doc, practicing physician. And so this thing is really, it all was inspired by Kevin's interest in helping his mom. So Kevin's mom came to him with this out-of-pocket spend for her meds that was unmanageable. He was able, as a physician, able to do, what any good skill set would do, which is find lower cost alternatives, find other ways to save on medications. And he reduced her spend by about half. And that inspired him to became this work in his clinic. So he started to build this big database around ways to save on your medication. He was doing this in his clinic, not necessarily because he was getting paid for it. He wasn't getting, this was not a part of a value-based agreement. This was just a doctor that saw that, the only meds that work are the ones people can afford. And so really that's the origin from which we come. And that's really informed a lot of who we are as a business. We've first come from this philosophy that the right steward for this type of work, which is the doctor and the patient relationship, right? It's like the most powerful leverage point. And if we can get the right information in the hands of the prescriber when they're making those decisions, we're gonna set off a lot of downstream benefits. So that's sort of thing one. And thing two is we've also gone at this strategically from a provider aligned perspective. So we work really closely with health systems like UPMC and Providence and UC Health, among others, and have come at the problem from a physician user perspective, because ultimately I think that's one in our sort of e-prescribing world that's been absent. And all of that comes back to Kevin Wendell's mom, right? It's like his inspiration as a physician of, gosh, I wish I had this information to help with patients. So that's the foundation. We even have a mantra in the business called Lucy Up.
Yeah, I see the poster on your wall.
Oh yeah, there it is.
What does that mean? So I was going to ask you about that.
Yeah, we give a Lucy Up award every month. Kevin's mom's name is Lucy.
Love it.
And, this is the inspiration for what we all do. Everybody's either, you might have been the Lucy, you may have a Lucy in your life, but everybody's got somebody in their life that's had this experience with the healthcare system that they couldn't afford or didn't make sense or was frustrating or confusing. And that's why we show up every day. So then that all comes from that original spark of Kevin serving his patients in Denver. So that's one founding story that's really important. I think separate from that, or a parallel to that, is my own interest is, I grew up in the health insurance business and literally grew up in the health insurance business. Like my family was benefits broker. When I got in trouble in school, I got sent home and had to go stuff enrollment packets. I grew up in the health insurance business.
That's awesome.
So it's, it's one of the all my life. But then when you become a patient, you start to go, well, why didn't, it becomes, even if you lived in it and swam in it your whole life, it's hard to navigate. It's hard to sort of understand as a patient. And that became much more clear to me working in it and then eventually as a patient of it. And it was one of those things where do you want to really, do you want to continue to participate in how things are, or do you want to find a way to sort of drive some different outcome? And that was my path. It's just, let's find a way to do something different.
That's awesome, man. Really great to hear that. I love the Lucy Up, because we all have a Lucy in our lives, whether it's us or somebody that we love or somebody that we care for, right, as a provider. So it's certainly interesting to hear that. It's also cool to hear about your background in the benefits space and sort of how you really do have an appreciation for both sides of the coin and understanding the importance of the best medication is one that people can afford. So love that all. Kyle, talk to us a little bit about what you guys are doing for the healthcare ecosystem. How is it all translating to value?
Yeah, for sure. And so as a little bit of context, what we do is we bring real-time, patient-specific, moment-in-time specific pricing and alternatives into the ordering workflows at docs. So we work with leading EMR systems, we work with leading health plans and PBMs, and we inject that information into the ordering workflows so that they can make the right decision the first time. So as a broad context, that's what we're up to. And really, from my perspective, that's about consumer choice. It's how do we introduce consumer choice into this electronic process? Again, to my knowledge, this is the only time in human history, e-prescribing is the only time in human history where we adopted an electronic process and consumer choice was constrained. When you had a paper script, you could go wherever you wanted. So when we got an electronic script in the early 2000s, it went from being routed from an EMR to a pharmacy without the ability to understand options. And really, the first time you understood what it was going to cost is when you showed up and were asked to pay for it. So, you and your provider were making a purchasing decision with no knowledge of the consequences of it. And our goal is to reintroduce consumer choice into that process. And now we're doing that at pretty significant scale. We're doing 15 million of those transactions a month. We'll do 20 million a month by the end of the year. And it's really about understanding the insurance benefits, understanding the alternatives that are appropriate based on your insurance benefits, and then solving a problem downstream from that. That problem might be a prior auth that you need to overcome. That might be an affordability issue that you need to overcome in a variety of ways. That might just be being able to communicate with your care team that you're not tolerating the med well, or that you're experiencing side effects, or just a reminder, get a refill. But all that has to be an integrated part of care delivery and not happening outside of care delivery, in our view. So we integrate directly into the EMR system to do these real-time benefit checks, to do EPA processing, and then even ongoing adherence work in a lot of cases.
That's awesome, man. It sounds very comprehensive. And yeah, all of this stuff should be part of the patient journey, should be consolidated. And it sounds like you guys are doing just that, from, best price drugs to prior auth. There's a lot of gaps that happen and a lot of care that gets missed. And so it sounds like you guys are doing a big plays here to make a difference. If you were kind of thinking about as the business, you're building the business, what's a setback that comes to mind and a key learning that came from that?
We've built a multi-sided network, right? And those are hard in every industry, but they're really hard in healthcare. And so part of why that's true is, if you think about it as a provider user, the tool's not relevant until you get the right data sources into it, meeting all of the health plans and PBMs and their pricing data. And the PBMs and health plans you're not relevant to them until you get the physicians in. So you're facing this chicken or the egg problem from the outset. And until you overcome that chicken or the egg problem, then it's almost impossible. You have to be able to cross that chasm to get to any level of value. And, we took a bunch of swings at that, and one of them finally worked. I mean, I think the biggest lesson was how important it is to be a directly integrated component of the existing workflows of providers and care teams. Is that, you ask them to move even a half a step out of those workflows, and engagement's not going to happen. And maybe even you end up building something that is adjacent or competitive with some of the existing tools, which is a risk in and of itself. And so I think our biggest learning there was just to understand that user experience really well, understand what both sides of that network are trying to accomplish, and then help enable that was ultimately what sort of ended up making the difference for us.
That's great, Kyle. Appreciate the summary there. As you think about all right, in the health system, how you guys position the solution, the provider's paying for it?
Free to the provider.
It's free to the provider. So then who ends up paying? That's always interesting to me.
We think about it in terms of supply and demand, right?
Sure.
So as a network, there's a supply side of the network, which is content that is hosted on the network to drive engagement with users. So demand is the user end, supply is the connectivity end.
Sure.
And so supply side for us is a variety. It's, PBMs and payers, it's cash programs, and it's other forms of affordability content on the supply side. And then demand side's provider and care team utilization. And so there are scenarios where the health system becomes a part of that supply side because they're a pharmacy or because they have some other adherence need. But ultimately, the user at the end of the day is not who we're charging. We're charging the supply
side. Okay, got it. So you guys are a marketplace. The supply side pays for positioning on there. And in the end, on the provider side, you end up getting transparency and the best fit for your benefits.
And ultimately, if you think about what we're actually trading on, it's behavior change.
Tell me more about that.
just delivering the data to a provider isn't where the value is derived, right? Like if you're only saying, hey, the GLP-1's $1,000, and you aren't then redirecting that to a lower cost site of care or redirecting that to a lower cost choice from the outset, then you aren't delivering any value. And so part of what we see as our differentiator is that we're delivering twice the behavior change when we engage those users with data. So that all comes down to a bunch of sort of really specific data exchange things that we do. But ultimately, what we're trained on is we know how to engage that provider. We know how to build trust in that transaction. And as a result of building the trust in that transaction, they accept the recommendations for lower cost alternatives that we provide. Because you get about 3 chances with a clinical user. And if it doesn't work 3 times in a row, they're never coming back. And so we've gone to great lengths to make sure that the data quality is high so that the engagement with that data is high so that we can then engage them with lower cost choices and drive value for our customers.
Super cool. I love that. And it's like a recommendation engine that has like some built-in nudges that helps them make the best choice for the patient and benefit, but also cost. Am I hearing you right?
Yeah, and those are related, right? Like the benefit cost is almost always the best option. That's not always the case. And where it's not, we can guide to more appropriate choices too. But yeah, the goal is high quality care at the lowest possible cost.
That's great. How are you guys leveraging the latest and greatest in Gen AI?
We have a really interesting project around prior auth right now. And, part of prior auth is the way it works today is that by and large, prior auth is just to throw everything at the machine and see what sticks process. Is that as a clinical user, you submit it all, and some of it will come back as denials, and we'll have to make different choices. And those might be cash pay choices, or they might be different bet. But all of that is retrospective in nature, meaning you made a choice, something you get a no, and you start over. What we're now doing is starting to build in kind of a guidance tools and decision support tools based on the actual policies of those prior authorization policies, because they're out there, right? Like we can go work with, leading health plans and understand the details of those policies, make recommendations in workflow before the med ever leaves the provider system, and take a ton of friction out of the middle of that process. And it's not just submitting everything and seeing what we can overcome. It's actually driving better decision-making on the front end, because we can say, based on you and the specific type of patient you are, here's the criteria you're likely to have to meet to get on this med and get it paid for by your insurance. Now, if you don't meet that criteria, now it's conversation about what you need to do differently, right? Like it might be a cash pay scenario, or we're going down a different path to get access to that med. But we save the health plan and the PBM the trouble of having to process that PA. So we save them, $50, $60 per occurrence. We save the provider system all the callbacks and friction and hassle associated with resolving that. And we, most importantly, get the patient on med faster and get them care faster. So that's squarely where we're focused with Gen AI right now. And I think it's going to be a highly differentiated solution.
Yeah, I love that. It's big opportunity there because it is a huge pain point for everyone involved, as you mentioned it. Well, Kyle, this has been phenomenal. Love hearing the updates from you and the things that you guys have been advancing on. Leave us with the closing thought. What do you want people to be thinking about as we close? And then what's the best place they could reach out to you and the team to learn more?
I think the closing thought is kind of the one we started with, which is that we deserve consumer choice in healthcare, right? How do we start to enable that in every way possible? And that's an interoperability question, that's a data liquidity question, and that's ultimately a price transparency question. And those are the things we're focused on solving. So you can find us, LinkedIn, arrivedhealth.com. We'll be at Health later in the year for those that'll attend those types of things. We'll look forward to seeing you on the road.
Amazing, Kyle. Well, yeah, we'll be at Health as well. So look forward to seeing you there. And for anybody that wants to connect with Kyle and his team at Arrive Health, make sure you check out the show notes. We'll put all the ways that Kyle just shared to get in touch with him. The time is now. We've got to make a difference in the way that we're delivering care. And a big part of that is giving consumers choice and making medications affordable. Kyle, thanks so much for being with us. This has been a real pleasure.
Thank you, Saul.